Folks, the COVID-19 cases are on the rise in 49 states. Now, experts say death tolls could hit some states harder than others because the vaccination rates are lower, I guess, as the Delta variant is now the most dominant strain, not only in the medical community, but in the media as well. This is countrywide. Joining us now to discuss, former U.S. Surgeon General Jerome Adams. Welcome back to Wake Up America, sir.
Hey, good to be with you this morning. And I just want to put in my plug. I still am available to go into space if they need an extra passenger. I'm not 18, I'm 47, but I'm willing to go.
Well, hang on. Let me just email Bezos real quick and let him know that,
If you can hook me up, I'd appreciate it.
Yeah, I'll put you in right behind me. All right, so, Dr. Adams, the LA County, they've implemented this mask mandate for everyone. Now, look, I'll always say, you want to wear a mask? Fine, no problem by me. I'm not going to make fun of you. Do what you do. However, the statistical data, we had a number of studies on this, showed that it was a bit marginal, let's just say. And the states that had the most lockdown mandates of masks and shutting down businesses and things like that also had the highest rates of COVID in most cases. So what do you make about reimposing mask mandates in LA?
Well, it's a fair question, and it's one that I've been answering for people a lot. And I want people to first understand two numbers. When we talk about containment, getting this virus under control, getting away from mitigation measures, we look at less than 10,000 cases a day in the United States. And we were almost there in June when the CDC famously said, hey, no more masking for people, or at least that's what people heard. It was really no more masking if you're vaccinated. We're now over 20,000 cases a day with this new Delta variant. So people need to understand we're going in the wrong direction very rapidly, number one. Mm-hmm. Number two, the Delta variant is 3 to 4 times more contagious than original strains of COVID. So if you got by last year without masking and vaccination, that doesn't mean that you are going to get by this year without masking and vaccination. Now, when it comes to those health officials, they're looking at belts and suspenders. They're really trying to do everything they can to protect the community. And when cases are going up and they can't compel people to get vaccinated, which I don't think is the right way to go personally anyway, I think you need to educate people and let them make a choice. Then they're saying, okay, well, what can we do to try to protect the community? And it's not 100%, nothing is, but understand where these health officials are coming from. And please understand, if we can get enough people vaccinated, then that will obviate the need for many of these mitigation measures, which, as you mentioned, aren't as effective as we would like.
Right. Well, and I'm glad you brought up vaccinations because, like I've always said, I'm probably never going to get vaccinated. However, there's a lot of people that it's very beneficial for. I had COVID. I ironically got it from a nurse wearing an N95 mask. I'm a fairly healthy guy, 38 years old. I'm old enough to remember videotapes and DVD rentals, as my co-host so kindly pointed out in the last segment. But the issue is, I had the virus. There's science to say that it's unlikely that I'll get it again. So what do you say to someone like me who's pretty healthy? I largely have not worn a mask during this whole thing, and I've had it. Or to someone who's been vaccinated, they went out of their way, they said, if I get vaccinated, I should be safe. And now they're saying, well, mask up.
Well, I love the way you frame that because you give legitimate reasons why you feel you are not at risk. And I don't shame anyone for that. First, we have to acknowledge that you are at lower risk than the average person out there. But we also have to understand that, number one, this Delta variant is 3 times more contagious. Number two,
but less deadly, though.
Pardon?
But less deadly.
It is. But what's interesting is when you look at the surge that hit England with the Delta variant and also the Alpha variant, it wasn't more deadly. It was more contagious. That caused more spread. If 3 times as many people are getting it, then that means you have 3 times as many chances for someone to die. So the virus itself is not more deadly, but it actually could have a broader impact. But to your question, I think another important point for people to understand is that the Delta variant is more elusive when it comes to antibodies from prior infection. Or to put another way, the vaccine gives you better protection against the Delta variant than prior infection does. And then number 3, we've got a lot of people out there. We have young kids. My daughter right now is unable to be vaccinated because she's only 11. My wife has cancer. My mother had a stroke. My father has cardiac conditions. The people who are vaccinated, but it's not 100%. And there are a lot of people who aren't. So I ask people to consider getting vaccinated to protect the community around you, drive those rates down, but it's your choice. You have to make the choice, and I'm not going to compel you. And the FDA needs to tell us why they haven't licensed these vaccines yet, because that's another reason that a lot of people give me for being concerned.
Yeah, and one of my concerns is if this vaccine is so star-spangled awesome, why does every creator, administrator, and the government hold no immunity for the just in case something goes wrong? That is the part. If that was wiped away and there was people held liable, I'd consider it, absolutely. Well, one of the other things too is you have the America heck no factor, which is the sense of like, hey, look, all right, I mean, we've had this. We had 14 days to flatten the curve, or over a year later, and they're telling us to put masks back on, the vaccines in place. Like, at what point does COVID fatigue just overrule any of the science or any of the advice from the experts?
Well, that's absolutely a problem we're facing. And that's why I also tell people, and I would say to you directly, and to people who are in your situation, we actually now have a tool that we've never had before, and that are these vaccinations. And if we can get enough people vaccinated, we've shown that we've been able to decrease the trajectory of slopes. And so please consider getting vaccinated. Talk to your healthcare provider. Don't trust me. Don't trust Tony Fauci.
Yep.
Trust your own healthcare provider and make a choice that's right for you as to whether or not you get vaccinated. But understand that if we can get enough people vaccinated, then we actually can start to move away from this pandemic.
Thank you very much, Doctor. Former Surgeon General Jerome Adams. We appreciate it.
Hey, and I'll see you in space one day.
Maybe with Bezos. All right.
Hey, I'm Rob Finnerty. Thanks for watching. If you enjoyed this video, please join the conversation in the comments below. Don't forget to subscribe, too. Hit the bell icon to be alerted to breaking news. And remember, there's a whole lot more on Newsmax TV, America's fastest growing cable news network. Newsmax TV, where real news for real people.